So the ruminant response to inflammation is different than what we've talked about. By ruminants, I'm mostly talking about cattle. And of course, in cattle, their number one white blood cell is the lymphocyte, meaning everyone else besides cattle, so dogs, cats, and horses, their number one leukocyte, of course, is the neutrophil, but in cattle, it's the lymphocyte. But their inflammatory response that we see, especially with acute inflammation, we see a neutropenia, and that's because their storage pool of neutrophils, is very small. And if you recall back just a lecture or two ago, that in horses and dogs and cats, when you see acute inflammation, we usually see a neutrophilia plus a left shift. And that's because the storage pool contains the mature neutrophils and some bands. And so when you have acute inflammation in dogs, cats, and horses, you see a mild neutrophilia, moderate neutrophilia with a left shift. But in cattle with acute inflammation, because it's this small storage pool, you're going to see neutropenia most often. And so in other species, that would worry us because that means that tissue inflammation is overwhelming, but that's not true in ruminants. This is their normal acute inflammatory response. It can be present with a left shift or without, and again, in the other species, that makes us even more worried because that suggests that it's a degenerative left shift, has a worse prognosis, but in cattle, that's okay. Doesn't necessarily mean it's bad, and you may see toxic change. You may not. The other thing you may see with it is a lymphopenia, and that is because of concurrent stress, just like in every other species. And so this neutropenia and left shift is something that you see, again, due to a depletion of the storage pool of neutrophils because it's small. But within 4 days, you expect to see some sort of response. So they should have recovered by 4 days. So here's our inflamed udder from mastitis. All of our neutrophils head there, and that's okay. But in a few days, you expect there to be proliferation within the bone marrow, so myeloid hyperplasia, which is going to repopulate the storage pool in the blood. So you expect either a normal neutrophil count or you can see a neutrophilia. If you don't see that, then you start to worry. But up until that point, you're not as worried, depending on what's going on with the cow, obviously. Mastitis is pretty common in terms of causing acute inflammation. Now, more chronic inflammatory processes, ruminants are similar to other animals. So when we talk about chronic inflammation, we're not going to necessarily separate it out. There's one other thing to talk about when we talk about large animals, and that's fibrinogen. And cattle especially can have only an increase in fibrinogen when there's inflammation. So they can have a non-cellular inflammatory response, and that's due to an increase in inflammation. And fibrinogen is a clotting factor, and with the clot, it gets converted to fibrin. But it also has a role in inflammation in that it forms the scaffolding for inflammation to cause and to allow for tissue repair. And remember that since it's a plasma protein, so here's your blood component, and here's your protein or your plasma component. Your proteins are albumin, globulin, and fibrinogen. So if you have serum and you've had a clot, you're only going to have albumin and globulin. But if you have whole blood, you're going to have albumin, globulin, and fibrinogen in that plasma. So to measure fibrinogen, you need a whole blood sample. That's the first thing to consider. But the other important thing to realize is remember that albumin and globulin can increase when you lose this plasma water volume, and that's true of fibrinogen as well. So increases in fibrinogen can be due to inflammation, right? Because that's one of the reasons, but you can also have decreased plasma water content, and dehydration can also cause increases in fibrinogen. I'm going to tell you now how to differentiate. So again, an increase in fibrinogen can be due to dehydration or it can be due to inflammation. And so we do something when our fibrinogens increase. We look at our plasma protein to fibrinogen ratio. And our plasma protein is in grams per deciliter, and our fibrinogen is in milligrams per deciliter. So you have to convert one to the other before you do this ratio. You only do the ratio when the fibrinogen's increased. So if your ratio is less than 10, and this is, we're going to say this is ruminants here. So if it's less than 10 in ruminants, that's inflammation. If it's greater than 15, it's dehydration, and this is ruminants. If it's somewhere between 10 and 15, we don't know. This plasma protein to fibrinogen ratio does not help us. Now, other measures like a left shift or an increase in albumin to tell you inflammation and dehydration respectively, the plasma protein to fibrinogen ratio doesn't rule those out. It doesn't mean that you can't have others. It's just that in the absence of those, this helps you to differentiate. Now, horses have different cutoffs. So in horses, less than 15 is inflammation, greater than 20 is dehydration, and in between, we don't really know. So one last thing I wanted to mention about this plasma protein to fibrinogen ratio and fibrinogen is that fibrinogen is really only increased in large animals where it can be detected in the ways that we normally measure it, and we do it by heat precipitation of plasma, although they're much more specific. So this is in large animals that we do this. It's not that we don't see it in small animals, it's just that large animals tend to have the greater increases in fibrinogen with inflammation and dehydration than we see in small animals. So this won't be something that you're going to see or really evaluate in small animals unless you're worried about clotting.